let's go a little deeper into active counseling techniques. Last week we worked with identifying the distress. That's step 1. And you remember the 4 steps of active counseling? Let's just go over them kind of briefly. What's step 0?
Your own attitude.
Yeah. Setting
so the
counselor's
listener's attitude.
Mm-hmm. Setting the counselor's attitude. And what are the components of that?
Open. A true desire to want to help.
Mm-hmm.
To be their intent.
Mm-hmm. Calm, loving attention. And what's your intention? How do you hold the client? How do you...
Loving regard.
Loving regard. Respect.
Respect, fully capable.
Yeah, trusting them. So you basically just take a moment, you center yourself, and then you look at the client and remind yourself this is a powerful and amazing being that has everything they need inside themselves, and you just kind of set that as your, and I actually recommend that you try doing this in your everyday life with your friends. Mm-hmm. It's pretty amazing if you just take a moment to set your attitude like that. People will totally feel it and they'll completely respond. Yeah. And then step 1, you pay attention in order to identify the distress. What are we paying attention to? 4 or 5 things specifically.
Their words, their body posture, their facial expressions, tone of voice.
Mm-hmm. Words, body posture, facial expression, tone of voice, and also breath. And it's more than just the posture, it's like the movements, the little things that are going on with the body. All of those things we're watching and trying to identify the core of the distress. And then we want to think of all the possible ways that we might counteract the distress. So a counteraction is anything that helps the client understand that their distress is not present time reality. Anything that's different from the way their distress was laid in, from the distress recording. And when you find something that's different enough, when you contradict or counteract the distress sufficiently, then the client always discharges. That's how you know you've counteracted it sufficiently, because they start to discharge. They might laugh, they might start talking, they might cry, shiver, get mad, whatever. They'll just start spontaneously discharging. So thinking of all the counteractions is something you usually just think of a few of them and then try some. But when we're first learning this, it's really helpful to think of a lot of them. Just try brainstorm. All right, what are all the things we could do? And I want to practice doing that a bunch today so that you really get a feel for it. Basically, you want to help the person feel more deeply and release their feelings and have permission to release their feelings. So you already have a few counteractions going on already. You already have your aware, loving attention. You have the feeling of respect and trust for them. You have your physical closeness and touching them, holding their hands maybe, and permission to let them feel. All of that's huge, and it wasn't happening when the distress was getting laid in. So you can go a long way just on all of those, as you have seen. But you can also ask them to do something in the session, which we call a direction. You could ask them to do a little role-playing thing, like, okay, well, I'll be your mother and You be you when you're 5 years old. Or you be your mother and I'll be you when you're 5 years old. You could do a little scene kind of thing. Or you could ask them to say something to the person they're working about. What did you really want to say to them, and have them talk to that person? Or you could have them stand up and just move around, or make sounds and breathe and hit a pillow. There's many, many things that you could suggest that would help the energy go deeper and help the emotions move. It's kind of a vast field of possibilities. So I'm just teaching you a few that I think are the most useful, that I use almost all the time. And the ones that I use almost all the time are breath, sound, and movement.